Assalamu alaikum wa rahmatullahi wa barakatuh. In this lecture, we will talk about the arrangement of meninges and spaces. What are the meninges? The meninges are three layers of membranes that surround the brain and the spinal cord. They include the dura mater, which is the outer tough layer, the arachnoid mater, which is a delicate middle layer, and the pia mater, which is the innermost layer that is firmly attached to the surface of the brain. As we see in figure B, the cranial meninges are continuous with and similar to the spinal meninges through the foramen magnum, with only one difference is that the cranial dura mater consists of two layers, but only one of these is continuous through the foramen magnum to cover the spinal cord. This figure shows the arrangement of meningeal spaces. There are two meningeal spaces, a potential one, which is called the extradural space, and a real space, which is the subarachnoid space. The extradural space is a potential space related to the dura mater, and it is formed as the outer or periosteal layer of the dura is firmly attached to the bones that surround the cranial cavity. Thus, a potential space is formed between the dura and the bone. This potential space can be an actual space filled with fluid when a traumatic event results in a vascular hemorrhage occurs. Bleeding into the extradural space due to rupture of a meningeal artery or torn of dural venous sinus results in extradural hematoma. However, tearing of a vein as it enters the dural venous sinus results in subdural hematoma. Now, the subarachnoid space, as I said, is a real space, and it is the only normally occurring fluid-filled space that is associated with meninges. It is formed because the arachnoid mater does not follow the contour of the brain. However, the pia mater closely follows the grooves and fissures on the surface of the brain. So, a narrow space, which is the subarachnoid space, is created between the two membranes. Between the arachnoid and pia mater. The subarachnoid space surrounds the brain and the spinal cord, and it is in certain areas enlarged into expanded subarachnoid cisterns. These cisterns contain the cerebrospinal fluid. The cerebrospinal fluid, or CSF, is produced by choroid plexus. The choroid plexus is present normally in the ventricles of the brain. It is a clear, colorless, cell-free fluid, circulate through the subarachnoid space and surround the brain and the spinal cord. The CSF returns to the venous system through the arachnoid villi. The arachnoid villi project as clumps or groups called arachnoid granulation. We can see here the arachnoid granulations. The arachnoid granulation projects into the superior sagittal sinus, which is a dural venous sinus. come back to the venous system. What is meningitis? Meningitis is a rare infection of the leptomeninges. The leptomeninges are a combination of the arachnoid and biomators. Infection of the meninges typically occurs via a blood-borne route, though in some cases it may be direct spread or trauma, or from the nasal cavities through the cribriform plate of ethmoid. Certain types of bacterial inflammation of the meninges are so virulent that overwhelming inflammation and sepsis with cerebral irritation can cause the patient to rapidly pass into a coma and die. Meningitis is simply treated with simple antibiotics, but certain types of bacteria that produce meningitis produce other effects. For example, subcutaneous hemorrhage, ecchymosis are features of meningococcal meningitis. The typical history of meningitis is non-specific at first. The patient may have mild headache, fever, drowsiness, and nausea. As the infection progresses, photophobia or light intolerance and ecchymosis may occur. Straight leg raising causes marked neck pain and discomfort, and an emergency hospital admission is warranted. Immediate treatment consists of very high dose of intravenous antibiotics and supportive management. Thank you.